Welcome to this lesson on how to place the Dexcom ONE sensor. In this video, we will guide you through the process of properly placing and removing a Dexcom ONE sensor and give you some additional do's and don'ts. 1. Supplies. To place the sensor, you will need the following: a sensor with a sensor applicator, a transmitter, and alcohol wipes. 2. Inserting the sensor. Follow these steps to insert the sensor correctly. Begin by washing your hands and disinfecting the area of the skin where you will place the sensor. Remove the protective film from the Dexcom ONE applicator, being careful not to touch the adhesive patch. Position the applicator on the designated area of the skin. Fold and break off the orange safety clip. Press the orange button to insert the sensor, then remove the applicator. This ensures that the sensor is properly inserted and can remain in place for the next 10 days. However, you still need to insert the transmitter. Disinfect the transmitter connection with an alcohol wipe and allow it to dry. Insert the transmitter with the narrow side first into the sensor and snap it securely into place. 2 clicks will confirm that the transmitter was inserted correctly. Finally, rub around the sensor patch 3 times to ensure proper adhesion of the patch. With these steps completed, your transmitter is securely placed and ready for use. Remember to reuse this transmitter for the next 3 months. 3. Removing the sensor. When it's time to remove the sensor after 10 days, perform the following steps for a safe removal. Remove the patch slowly from your skin. Break off the sensor tab on the wide round side of the sensor holder. Slide the transmitter out of the sensor holder. Keep the transmitter for reuse in your next sensor. 4. Do's and don'ts. Here are some important tips to keep in mind. When placing the sensor, it is recommended not to press the inserter too firmly in order to avoid bleeding. Bleeding is not automatically a reason to remove the sensor. Clean the sensor holder if there is blood before inserting the transmitter. If the bleeding persists or the insertion site is uncomfortable, remove the sensor. After placing the sensor, the transmitter can be clicked into the sensor holder. Caution! First click in the transmitter tab on the narrow side and then press down the round side. Avoid discarding the sensor and transmitter code, as you will need it later for starting the sensor. It is recommended to take a picture of the codes to avoid losing it. This is particularly important for the transmitter code, as you will need it over the next 3 months. Remove all transmitter numbers from your phone's Bluetooth settings. Failure to do so may result in the device continuously searching for the old transmitter. If there is no overtape included with your Dexcom ONE sensor, you can request it for free from Dexcom. This overtape helps to extend the longevity of your sensor. If you encounter any technical difficulties, please reach out to your local Dexcom technical support for assistance. While Dexcom absolutely does not support this, some people attempt to resolve the issue by disconnecting the sensor and transmitter and repeating the setup process. To remove the transmitter from the holder, tools like a bank card, test strip, or hair clip are sometimes utilized. Instructional videos demonstrating these techniques can be found on YouTube, although these methods are not endorsed by Dexcom. When faced with challenges in placing the sensor, remember that each attempt brings you closer to mastering the technique. Take note of the tips and tricks shared in this chapter, and don't be discouraged by initial difficulties. With patience and practice, you'll become more skilled in successfully placing the sensor.